Hi, I'm Dr. Stephen Adorn, and welcome to the health segment of Western Wisconsin Journal. I'm a family practice physician from Hudson, Wisconsin, and I've been doing this show for about 5 years now. Today, I have a little potpourri for you. Um, Three topics. The first topic is on the PSA controversy. You may have seen this in the paper. There's been some recent recommendations that many people in the medical world don't agree with, and there's controversy there. But first of all, what is the PSA? Well, PSA stands for prostate specific antigen. Big word. Basically, it's a chemical that comes from the prostate. All men have this, and all secrete some, unless you've had the prostate removed, and then you're not going to find any. The chemical is drawn through the blood. Now, high levels of PSA can sometimes mean that you have prostate cancer, and that's how the screening works. Or if the level jumps up all of a sudden, so at one point it's just 1, and then next year all of a sudden it's up to 4, it's quadrupled, then that's a sign of problems and has to be investigated. However, there are some things that give false positive. False positive means that you don't have cancer, but the test is up. And that's part of what this committee was trying to say when they said we should not do PSA for screening. Now, just doing a rectal exam, which is part of the screening process for prostate cancer, can make it go up. Also, as men get older, their prostate gets enlarged, and that would make the PSA level go up. So what is the controversy? A government group and consortium got together, looked at the good things about the PSA for screening and the bad things. And they recommended not to do any PSA screening whatsoever. Now, it can be used as a tumor marker. And for instance, if somebody has had cancer, and see if it's gone away or come back or in the bones or something. But for screening purposes, not to use it. Well, of course, the urologists get all up in arms. This is how they make their bread and butter. And they do biopsies, they remove prostates, and they want screening to be done yearly. So there's got to be an in-between that is reasonable. And you need to talk to your doctor about that. Every 2 years, every 3 years. I read one recommendation: if the PSA was very low, 1 or under, you didn't need to have another PSA for 5 years. In general, we have a rule that men over 75 don't need a PSA. They're going to die from other reasons: heart disease, stroke, other cancers than prostate cancer in general. When do we start the screening for PSAs? Generally in high-risk patients like blacks or family history of prostate cancer, we may start at age 40. So one of the problems with prostate cancer is how aggressive is it? And that's why the screening is so difficult. If you find cancer, we automatically treat it, and we treat it with the best methods that we have. Removal of the prostate, using radiation. However, some prostate cancers grow very, very slow, but we don't know which ones they are, and therefore everybody gets treated the same. Some people don't need any treatment at all. And so that's what this investigational group, oh, by the way, I believe it's the same investigational group that said that mammograms didn't save women. But this is what they had come up with, is that we're doing more harm by doing PSAs. How can we do that? Well, if the PSA is high, it usually leads to biopsies. The biopsies are done through the rectum, and usually there's about 12 of them I'm always amazed at the pathological report from the urologist's biopsies. I mean, there's 12, no cancer, no cancer. Okay, we found adenocarcinoma. You know, so they will find cancer, but the problem with that is it can lead to infection. Okay, what about people who get surgery? Well, surgery can lead to incontinence. You leak urine. It can lead to impotence, which keeps Viagra in business, huh? Also, you can get radiation treatment. Well, that can lead to inflammation of the rectal area, proctitis, and that's uncomfortable, bleeding. So this is why the government group recommend not doing the screening. Well, in my opinion, sometimes you're better off walking right down the middle of the street and not doing the PSA test every year, but maybe every 2 to 3 years, maybe based on risk. But you have to talk to your doctor about that and what you think is best for you. Payment. If something is not recommended for screening, you might have to pay for it for yourself. And I can't help but wonder whether these committees that are recommending not screening with mammograms and not screening for PSAs are somehow trying to save money, maybe save the government money. Maybe they're looking at single payer system down the line and what kind of rules we're going to have for a single payer system. Yes, that's government-run medication, government-run health plans. So I would say talk to your doctor about the prostate-specific antigen testing and for prostate cancer testing. The next issue I wanted to talk about was drug testing. The use of prescribed drugs illegally is just astounding in this country. There are a lot of people who are actually overdosing on prescribed medications. That means they're being prescribed for somebody who may be abusing them themselves or selling them. And clinics are trying to get tougher on this. With computers now, we have ability to track where drugs are filled, medications are filled. But most recently, we've introduced a lot of urine drug screen testing. And Quest, who is Hudson Physicians' laboratory, did a study. And they took all the people that were supposed to be taking prescription medicines and those that had a drug screen. They checked to see if the drug screen showed anything. And what they came up with was 61% of drug tests for people supposed to be on a narcotic were abnormal. A lot of people take narcotics on a regular basis. For instance, class 2 narcotic would be a major stimulant like Ritalin, which is methylphenidate, Adderall, which is a mixture of salts that are amphetamines. And they're supposed to be taking it every day, and they're not. We can't find it in the drug screen, but we'll find something else, maybe some marijuana or some other narcotics in there. And that's what they're talking about, 61%. So some people weren't taking any meds at all, and they were selling them. Some people were taking the medication and other drugs on top of it, marijuana. Some people were taking other drugs and not the one that they were prescribed. And that makes you infer that they're selling the drug they're prescribed to get the drug that they preferred, like marijuana or heroin, whatever. All right. The results of the study are just plain scary to me as a provider. That almost tells me that 2/3 of the narcotics that I'm prescribing are going in the wrong direction. 2/3 of our narcotics prescribed patients are abusing their privilege. Narcotics selling or even giving them away is illegal. It's a felony. Because of the drug-seeking behavior that we have seen, we no longer carry narcotics on site at our clinic. In the old days, you would give someone with bad pain, maybe a headache or some other bad chronic pain, we would sometimes give an injection of narcotics. We no longer do that. So the drugs, prescription drugs in the U.S. is a major problem, and we're starting to crack down on it. One is just use of computers and seeing how often a drug is prescribed, who's prescribing it, what pharmacies they're getting the drugs at. Doing urine drug testing can help cut back on people who are abusing prescription drugs. The third and last topic that I want to talk about today was a report that came out of St. Croix County, Hudson's and St. Croix County, and it goes back to my old pet topic of diabetes and obesity. And these are the 2011 burden of diabetes in St. Croix County. One of the numbers that interests me was there are 5,350 diabetics in St. Croix County. That's about 9%. So you can think about 1 in 10 of people have diabetes. And that's what it is around the world. So we're very similar to that. In terms of hospitalizations for diabetic-related problems, almost $7 million in this county alone went to hospitalizations for diabetics. Now, what are the total costs? Medications, laboratories, loss of work, all kinds of added up. All right, in this county alone, it's $68.7 million, $69 million. This is a big problem, and one that's easily corrected. Well, maybe not so easily, but there is an easy solution. One of the solutions is lose weight. 26% of St. Croix County people, 1 in 4 people, are obese. And obese means a body mass index over 30. They measure your height, they measure how heavy you are, they come up with the body mass index. Normal is 25 and under. Overweight is 25 to 30, over 30 is obese. And there tends to be complications with being obese. The first one is you tend to get diabetes. For instance, here in St. Croix County alone, if you look at all the diabetics, 87% of diabetics are overweight. And that just makes sense because we know being overweight causes diabetes. It has something to do with insulin resistance with all that fat that you carry around. So that's about 2/3 of St. Croix County is overweight. People that have diabetes are generally overweight. We really have, besides what I talked about before, drug problems. We have an overweight problem. And we really don't have a good medication or drug to solve the weight problem. The ones they have now have been associated, well, they're basically speed. They're associated with some heart valve problems. The drug company that comes up with a pill for weight loss that is not harmful, I like to have stock in that company. Let's put it that way. All right. One of the topics I discussed here many times, and maybe we wouldn't have a healthcare problem or spend so much money on healthcare, we wouldn't be harassing Obama so much about his healthcare system, heading to the Supreme Court and all that kind of things, is if we just do a few things ourselves. 20% of people still smoke. But 1 out of 6 people have what's known as the metabolic syndrome, which is related to obesity. So they have obesity, they have high blood pressure, they have high cholesterol, and then they have diabetes or glucose intolerance. Watching what we eat, exercising, losing weight, stop smoking. We did this type of thing, we would not have a healthcare problem. I mean, look what it costs the county here in the county. I just go back to, just going in the hospital in St. Croix County. It's $7 million just for diabetes hospitalizations that are related to it. A loss of $69 million for direct and indirect costs dealing with diabetes. That's a lot of money. And if we didn't have to spend that much money, maybe we wouldn't have so expensive health care. So something to think about. So in summary, today we talked about the PSA testing. And with PSA testing, it's for prostate cancer. You need to talk to your doctor and figure out what's best for you. We also talked about the overuse of prescription drugs. And we talked about obesity and diabetes in St. Croix County. Thanks for watching. I'm Dr. Steve Adorn.